Hi, everyone. My name is Adriana Kohler. I am the Policy Director at Texans Care for Children. We're a statewide children's advocacy organization. We work to improve the lives of Texas kids and families. Usually we're at the Texas Capitol with you all working the legislative session, and here we're working on two fronts and working with federal members to make sure that bad policies or cuts that affect kids and families, that they don't happen. I just want to make sure because it's hard for me to see who has logged in. Has the Congressman logged in? I'm not sure if I can see on my end.
I am checking.
Well, in the meantime, we are honored to have uh, Congressman Joaquin Castro has graciously accepted the invite to join us today for some remarks to talk about the urgency of action at this time. It really is a moment where this is not a fire drill. This is it. This is happening. And it's really important for us all to take action. And we're here to talk today about the important issues and then what you can do, specific steps you can do in the next few days, in the next few weeks, to make sure that that cuts don't happen to these important programs.
Yeah, go ahead.
I'm getting a call. I bet this is the scheduler. So let me, if you don't mind, I'll just take that real.
Sure. And while she's doing that, I see a couple of people have their hands up. Dan and Ben. So Dan, I'm allowing you to talk. Uh, I think you have to unmute.
I didn't do it on purpose. Sorry.
Okay, put your hand up. Ben, what about you? Do you have your hand up on purpose?
Okay, thank you. Perfect. So that was the congressman's office. He said he's under Ben Thomas as the name.
Okay.
And so I accepted Ben Thomas in. Hello. I think he probably logged in under another Zoom account. Sorry about that. No. Okay.
Okay. So
hi everyone. Can you hear me?
Yes.
Hi. Do you have an image? Do you guys see anything? Okay.
We see the name. Yeah.
Is there strange? It's like it's not even giving us an option to turn our video on this Zoom link.
Oh, I see. I see what you mean. Yeah, it allowed me to press allow to talk, but I'm not sure if it allows to promote to panelists. That's what I'm going to do. There we go.
Okay, wait. Yeah.
There we go.
Congressman?
Hello, y'all. Can you see me? Sorry, we trying to figure out what was going on.
Thank you. No,
Working off of my chief of staff's computer here.
Of course. Thank you for contacting us for those tech difficulties, and we're glad we can get you in. I didn't know. We are honored to have you here, Congressman. We just did quick intros. My name is Adriana with Texans Care for Children. And we're co-hosting this webinar with Texas Impact, and we have amazing members of Texas Impact on the phone. So I will just you are a man that doesn't need an introduction, but just in case, we are honored to have Congressman Castro here, who is a leader on various kids and families issues, representing portions of Bexar County, San Antonio, a leader in San Antonio and the surrounding areas. And we just want to kick it off to you we're here, we are all active and engaged, and but we want to know from you what's at stake here.
Well, thank you, Adriana. Thank you to B and everybody at Texas Impact. Thank you so much also to the congregation leaders, faith leaders who devote so much of themselves to serving the most vulnerable in our state. As you all know, these are very trying times for our country and for Texans, but especially the most vulnerable Texans. And the next few weeks are going to be especially crucial and critical as we think about the future for these folks. The Congress is on the verge of passing what would be the most damaging bill in terms of healthcare services, particularly to the poor, but also to people like senior citizens who rely on Medicaid or long-term nursing home care. My grandmother, for about 2.5 or 3 years near the end of her life, was in a nursing home in San Antonio. Also to the disabled who rely on Medicaid. So the facts are these. The Republican bill that's going to come to the floor, we're expecting it to come to the floor as early as next week, would cut more than 10 million people across the country, in fact, almost 14 million people or so, off of Medicaid services. It would cut millions more off of SNAP or nutrition assistance. And bear in mind, this is already after our food banks across the country have taken a big hit from the Trump administration. So we have two very challenging and tough things going on for the poor and the most vulnerable. On the one hand, you have inflation, so prices, including grocery prices, are going up, and it's getting harder for people to put food on the table, to afford pay their bills, to support their families and themselves. And on the other hand, as those prices go up, what you're seeing now is that services will go down. And as you all know, really, when prices go up and people are struggling financially, it should go in reverse. There ought to be more services for people. The social safety net should get larger to take care of those people, most of whom are still working hard, still going to jobs, some of them 2 or 3 jobs at a time, like my grandmother worked for decades, but still struggling to make ends meet. And so the long and short of it is the next few weeks when the House of Representatives in Washington takes this vote, and then when the Senate takes its vote, where we really got to reach out, folks need to reach out to their representatives. And in Texas, there are a few crucial areas that are important where I do think that the representatives, I think, are trying to make an assessment because they have large populations that rely on Medicaid services. That is the West Texas area and the San Antonio area where Representative Gonzalez, where he represents, his district, is adjacent to mine. And then Monica de la Cruz in the Rio Grande Valley, who is in her second term, I believe, and represents a population that very much relies on Medicaid. Many other folks rely on ACA subsidies because many of those would be cut as well. So people's premiums would go up. And so those 2 districts in particular, but in addition, please reach out to your members of Congress, to our senators, and then beyond that, y'all, I would ask you this, to please share your stories, share them with your family and your friends and your congregations and on social media about how these cuts would impact you or the people that you love. And to close, I want to give you a quick story about why this is such a personal thing for me. A few years ago, I was diagnosed with neuroendocrine cancer. I was in Spain and I was in a car accident. And just as I was taken to the hospital, and just before I got dismissed, the nurse came over to me and she said, my radiologist called down to me and said that he believes he sees 2 tumors that have moved from your small intestine into your liver. And so this doctor was telling me that I was diagnosed with cancer. And that was the summer of 2022. I started getting treatment in September of 2022. And in February of 2023, I had surgery at MD Anderson and they took a bunch of stuff out. And I spent 10 days in the hospital. And fortunately for me, my tumors, the remaining tumors that I have, haven't grown for 3 years. I just need them to not grow for about 40 more years, and then I'll be perfect. But I had to become an instant expert on insurance, on deductibles and premiums and co-pays. And I now pay, I think, close to about $1,500 a month for insurance for myself and my family. But there were times in my life growing up, and even as an adult, periods where I had And one line stuck out to me, and that was the treatment for this drug that I have to take every month. It's an injection, and the drug is called lanreotide. Was about $24,000 per injection, per shot. And I asked the folks in Bexar County at the public hospital, what happens? And I knew the answer, but I guess I was hoping for a different one. But I asked them, what happens to the people that don't have insurance or, they're underinsured? And they said, there's a lot of people that don't get the treatment that they need for that type of cancer, or they struggle to get it and may only get it sometimes. And that's one type of cancer, and cancer is one type of illness. There's diabetes and sickle cell and hypertension and all of these other things that people are dealing with. And unlike the things you hear about, folks, that most of our folks that are on Medicaid, they're actually working, or they may be working poor. They're actually trying to support themselves and their family members, but oftentimes they've been maligned by people who use that for political gain. And so please share your stories, reach out to your elected representatives. I know that your voice does make a difference, because I know the people here in Congress, I know that in the front and the back of their minds, they're thinking about what they're hearing on the phones, online, in emails, in the correspondence. So you can make a difference. Now is the time to make it. Thank y'all so much for having me, and God bless y'all.
Thank you so much, and for sharing your story as well. Plus, it's really profound, and very difficult to get through. I'm so glad you're well and healthy now, and thank you for
Thank you.
making sure we understand the urgency. I know you're short on time, so
Thank you. Thank you all for having me.
Thank you so much, Congressman.
Take care.
All right. Thank you. I think I'll kick it back to B.
Yes, and what I'm actually, before I do anything else, I want to make sure that, so for some reason my internet is unstable. So I am making sure that we have another staff member who is also a host. I'm going to make her be the host, in fact, so that if anything happens to my internet, we don't lose everything. So, okay. Well, I hope everyone was able to hear what the Congressman was saying, and he has been a stalwart champion for us. I'm going to turn it over now to Andrew Fuller, who is, Andrew, you're going to have to say exactly what your title is. I'm so sorry. He's a domestic policy genius at the Evangelical Lutheran Church in America. I know we have some of your ELCA folks on the call, and you're going to talk a second about WISC. But Andrew is one of our folks who is in DC. He's got cherry blossoms behind him there, who is interacting with the members of Congress all the time. And he's going to talk to you about what's going on from where the faith communities sit. And hopefully also, Andrew, talk a little bit about what the faith communities collectively are doing in DC to try to fight, and how people in our state can help. So, Andrew Fuller, take it away.
Gotcha. Yeah. And it was great to see the congressman too. I used to work more closely with his brother, Julian Castro, when he was at HUD, who really was a leader early on in really building out the faith-based development office at HUD. So great family, great advocate, great leader in Congress for sure. I guess I'll just really quickly start with an overview of my role. So I work for the Evangelical Lutheran Church in America in their DC office, and we also have great partners like B in Texas and across the country as well. I cover economic policy, but I also coordinate the sort of domestic policy within our office. So that covers things including hunger, housing, Medicaid, and other things like that, right? And the congressman was absolutely right. This probably is one of the most monumentous times since I've at least arrived in DC over a decade ago, in terms of seeing the most major reductions to anti-poverty programs in our history. So, B also mentioned the WISC, which is the Washington Interfaith Staff Community. Essentially, like if you are Episcopalian, Jewish, or Islamic, all of our denominations have different counterparts like me, who work on domestic policy, international policy, and other things like that. And so WISC, the Washington Interfaith Staff Community, is sort of a network of like all of our representatives like meeting together. So I actually co-chair the domestic human needs portion, which is like the domestic advocates across, other denominations as well. So this really is a sort of joint interfaith effort that is alarming all of us. Do you want me to sort of go into sort of the SNAP portion particularly? Okay. The Congressman did a great job sort of summarizing the impacts to Medicaid, and there is a lot to it. I'll go over some of basically what's been happening with SNAP, since that just happened overnight, and basically give you some timeline stuff. And just know that Medicaid and other concerns are on this as well. So, yeah, just sort of did a little bit about me. So really quickly, for those of you who don't know, just a really quick, I hope most people understand this, but just an understanding what SNAP is basically. It's the largest sort of food assistance program nationwide, but it's not really that robust. On average, the average participant only receives about $6 a day. And I don't know about you, but like by breakfast, just the coffee, like I'm almost through that, you know what I mean? So it is not a sort of, people are not buying truffle oil on this program. The benefits are delivered through these little EBT credit cards that sort of like function as debit cards, and like money is just automatically delivered and dropped into those programs. SNAP is administered at the state level. So, and the applications are actually processed by the state agencies. And up until this point, throughout SNAP's whole history, Congress has paid for the benefits part, whereas the state administration pays for about half the administrative cost. And it's also worth noting that this program already has existing work requirements and time limits, right? It is not a sort of like free food program as in existence. Right now, there are work requirements in particular for able-bodied adults without dependents, as people without disabilities or children aged 18 to 54, and there's additional requirements after that. That's what it is right now. And I think most people in our denominations are already saying that's not enough. Food insecurity is growing. This is like, we're barely treading water here, right? Last night, I was like in the committee room, basically over like a near 24-hour session, as they were marking up their reconciliation package, and they have a few proposed changes. The main headline that you need to understand is that there is a proposed $300 billion reduction to federal benefits over 10 years. This is largely through increasing the state cost share, which is the amount that like Texas will need to sort of pay into this program, newer and tighter work requirements, more paperwork, more barriers, and more people being cut out of the program, neutralizing future updates to the program, which impacts the benefits amount. And also, it removes some parts of the utility deduction limits. Also worth noting, and this is sort of the side not really impacting SNAP directly, but there are also parts of the Farm Bill in this package. And the reason that's a problem is that by taking some of the farmer commodity stuff into this bill, they're breaking apart the coalition of this longstanding bipartisan effort of combining farm programs with food and nutrition efforts. That coalition has been together for decades now, and they're basically taking tiny parts out and removing all oxygen and political momentum to pass a farm bill later this year. So for those of you who care about a farm bill, this is like really alarming that this is like they're basically dissecting this and pulling it apart. And also finally worth noting, you'll hear some talking points that like, well, SNAP is too big. We need to start cutting back, right? Like we can't sustain the program in perpetuity. It's too large. But it's worth noting that this wider package actually isn't going to reduce the deficit. Oops, I went too far. these cuts are made to pay for a larger tax cut across the board, which, according to the Committee for a Responsible Federal Budget, will increase the deficit by 3 to 5 trillion over 10 years. If it gets to that point, we will be at like a deficit, like in a total debt of 125% of GDP, which at that point, like it starts to have really negative economic impacts. So what this bill is doing is it's cutting benefits from people, it's adding more paperwork, and it's increasing the deficit to pay for tax cuts. This isn't great. For those of us who believe in a sufficient, sustainable livelihood for all, which is our Lutheran social teaching, this is like an alarming cut across the board. So just really delving into just the SNAP component, and this is actually sort of relevant to the Medicaid side as too. They are increasing new work requirements for people up to 64. Currently, there's work requirements up to people age 55. They're increasing the paperwork. They're redefining what a dependent is to age 7 rather than age 18, which means if you have a child who is aged 8, you are now expected to have work requirements. The idea was this was basically like, oh, like children are going to be in school, like so parents don't need to, they should be working. But like if you're a single parent or if you have a child over the summer for those 3 months, that's a really alarming prospect. So we're really concerned about that. And also they are making it harder for states to waive certain requirements or offer waivers for work requirements. This is a really important component when there's an economic downturn, right? States need some extra flexibility if there's mass unemployment to be able to boost up SNAP a little bit, right? By waiving this, especially during a time of like when we're not really sure what's going to happen with the economy, you're really weakening the ability for the program to be flexible in times of crisis. And then the cost share, and this is relevant to B for sure, and everyone who's working on state level advocacy. So for the first time ever, SNAP is going to have, if this bill passes, a state cost share for the food benefits. So it will be anywhere between 5 to 25%, depending on the error rates that your state has. According to the sort of House budget estimate, Texas, because of Texas error rate, that would be a roughly 15% benefit cost share in this current estimate, right? I don't know about you, B, but like that would be billions of dollars over the course of several years. I'm not sure the state budget has that. But on top of that, federal support for administrative costs, which is, it will be going down from the 50% partnership to just 25%, meaning the state will have to pay for 75% of the administration, right? Basically, you'll hear a lot of talking points from the supporters of this bill that, we're not actually cutting anything. We're just like shifting more responsibilities to states. But really, effectively, this will be a cut, especially for states that can't afford it and low-income states, which are around Texas as well. I want to highlight, as you're doing some advocacy, that we have some great federal partners, and I'm sure Adriana and others have other resources as well, but the Food Resource Action Center has some great local fact sheets about the reliability of SNAP in Texas, right? So as you're talking to members of Congress over the next few weeks, please use these resources. Please use local statistics to say why these things are important to you. And I can drop that fact sheet into the chat in a moment as well. And finally, timeline. What's going to happen, right? I haven't quite given up on the sort of federal prospect in the House yet, even though the congressman said, like, you should be talking to the Senate. You should talk to both. So right now, the House is finalizing their committee markups, right? I think there's a budget committee hearing on Friday and one last hearing on Monday. Speaker Johnson's goal is to pass this before Memorial Day, so that would be by Friday. And after that happens, then the Senate will be starting their process. So that will be including doing their own markups in committee, passing it, and then they will need to conference the House version and the Senate version together. And the goal of both Speaker Johnson and Majority Leader Thune in the Senate is to pass this to the president and get it to his desk by July 4th. That's a little ambitious of a timeline, right? We're not really sure if they're going to meet these deadlines, but that's sort of the goal that these folks are having. So these next few weeks is like go, 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 go time. If you like, I'm calling my members of Congress every day, right? There's no restriction to the amount of calls you can make. So this is the time to be calling and making effort. Okay, and why it matters. Like basically, this is the lowest cost, or the biggest reduction to safety net programs that we've had in decades, if not ever, if not history, right? I don't know about you, but I've been talking in my local community, like food insecurity is going up massively, especially among families with children, right? You're seeing people more and more sort of come to food pantries and shelters who like never thought they would ask for assistance before. This isn't a time to be weakening our safety net. It's a time to be reinforcing it, right? And basically, if this goes through, we'll be in a situation where we have a reduced safety net ahead of a possible economic turbulent time, with like these tariffs and everything like that, looking at the prospect of a massive debt that we won't be able to sort of make up in the future. That is to say, the community of faith and pastors and lay leaders, it's a really monumentous time for us to be saying what our realities are on the ground and why we think this is a moral crisis. So we have our own sort of action alert that we're using to get people to call. There's a little QR code if you wanted to go straight to our sign up page. Uh, or if you have another referral of just like basically the summary of this is just call your members, you know what I mean? Call your House members, call your senators, and basically use local statistics. Go ahead, B.
All I was going to say is for folks on the call who are used to Texas Impact's Action Center page, I believe this is the case that we have our congressional 800 numbers on that page now. If not, we'll make sure Rebecca, who's on the phone with me, that's working on this issue, we'll make sure that those are there by tomorrow. But the real truth, just as Andrew is saying, Adriana is going to give you some phone numbers as well. The most important thing is that people are doing something. So whatever is working for you, if you're in an ELCA congregation, certainly it's great if you want to use the ELCA's stuff. And if you're in another denomination or tradition and you have received content from them, we hope that you'll use that also. We just want to make sure that the most important thing, and Andrew, maybe you can talk again. I know we definitely talked about this earlier today, that it's very frustrating that what people are talking about is the Qatari airplane, and that's the federal information people are getting rather than the fact that we're fixing to cut benefits.
Yes, exactly. And it is worth saying, like, if you share stories, I don't know if you want to be the point person, B, but like, I know we're collecting stories on the Lutheran end, like, and when I get those, I am delivering them straight to the lawmakers' offices, like, in paper, knocking on their door and handing it to the staff and the members, right? So, like, this is like a critical time to be doing that, and that's what the faith community has been doing so far. We've been meeting with House members like over the last few weeks. We've been showing up to these committee hearings, basically, it's kind of maybe it's because of that news thing. Like some of these hearing rooms have been empty when I've showed up. You know what I mean? It's the faith community who are like the only people turning up. Kind of alarming. So, point being, we're trying to make a dent. We're trying to say that we're noticing this and not letting this slip by. But it's going to take what I do as an individual will mean nothing if constituents and people are not calling in, right? That's where the real momentous like effort of where this will make or break will happen, right?
Exactly. And I mean, I think we're seeing, maybe I'll just take a moment to say, we have seen some of that behavior in Texas too, that the faith community are the ones who are consistently showing up. We don't want to like put everything on y'all's shoulders, but right now it is a really important time for our congregations to be taking a lead on this stuff because people are fragmented, they are discouraged in many cases, and just to know that you have advocates like Andrew in DC who are there to provide resources to you and also to groups like Texas Impact so that we can get you what you need. So Adriana, you have, I think, a couple of additional slides about Medicaid specifically. Am I right? Or about process, if you wouldn't mind sharing those, because we do want people to understand food. The SNAP is more alarming than we thought it would be, and that has made everyone shift their focus a little bit. But that's not to say that Medicaid isn't just as bad as we thought it would be. So if you want to go ahead and talk about that, that would be great.
Sure. Great. Exactly. Let me see if I can share screen. All right, and I will be quick. Some of this stuff is pretty wonky, so I want to make sure sometimes having it visually is helpful. I will echo that the SNAP bill provisions are scarier and more devastating than what ended up being in the budget reconciliation bill as it relates to Texas. And there are differences in every state on how the Medicaid provisions will impact every state. But that is not to say that it is still going to be a dramatic effect and hurt healthcare access. This is basics on Medicaid. You all know this. We don't do Medicaid expansion. We primarily cover children, pregnant women, seniors, and people with disabilities. 3 and 4 Medicaid enrollees is a child. So what are the changes in here? So I tried to go through all that. You're going to see a lot on the news about work requirements. That is affecting the Medicaid expansion population. That is crucial and devastating in other states, the other 40 states that have taken that up. That doesn't impact us. So we will not see work requirements at this time. But what it does is some other stuff that I call it death by 1,000 paper cuts. It's a freeze on funding that hospitals can use to bring down federal funds. So it's not cutting it, but it's freezing it for the next 10 years without any growth. So as you see more people move to Texas, more births, people grow their family, the funding is flat for the next 10 years. And we use a lot of creative tools to do some local initiatives to bring down federal funds, and they're frozen. Can't do any more of those. We have, I think, 24 local provider tax ways that we bring down money. Done. Frozen. Now that is not going to affect hospitals tomorrow, but it's going to affect them in a year, in 2 years, in 3 years. And what does it mean? It means a smaller staff, maybe job losses. What we're hearing is that they may close a particular unit, like a pediatric specialty unit, that doesn't bring in as much as the rest. Or you might see a suburban hospital that has a labor and delivery unit, but may not have it in a few years. We're seeing rural hospital labor and delivery close. Now we might see the suburbs close. It's these things that are going to add up. Some other tangible things that are in there that affect Texas is repealing some great rules that passed last year that would streamline eligibility. So it takes it away. So that means Texas is going to go back to a 90-day waiting period for kids in CHIP. A child is to be uninsured for 3 months and show they're uninsured before being eligible for CHIP. What is that? What the heck is that? That is something we've been fighting for so long, and it was finally going to be prohibited last year, and now we're going to go back to it. Some stuff about retroactive coverage, which will mean more uncompensated care to health clinics, FQHCs, hospitals, and this thing called reasonable opportunity period. It really affects families that apply and need to, particularly if you need to prove your citizenship by getting some more paperwork or a birth certificate, and you need to have it all ready at one time instead of before you would have about 90 days to get the paperwork together and you could have healthcare in the meantime. You have to have it all together. And that takes sometimes months and months for all that paperwork, especially if you have a complex situation in your assets or your income, or maybe you were born in another state and need to get a birth certificate. I know this sounds so in the weeds, but this is going to affect a family. They're going to have to spend hours and hours at the kitchen table trying to figure out this paperwork, go into the Medicaid offices over and over and over and over, and it will lead to coverage losses. Now, how do we talk about it? There has been, there's a lot about Medicaid cuts and work requirements will cut people from coverage, but we can't really use those talking points here. So what has worked and what the polling says is that terms like this Congress rushing to pass 700 billion. The dollar figure works. Saying the number is helpful. Rushing to cut 700 billion in Medicaid cuts. Say cuts, and apparently the polling suggests use cuts in relation to healthcare. Say Medicaid cuts and healthcare cuts. Terminate healthcare. Not just one, but use both together. Apparently that works better with all the audiences, including lawmakers. And then say who we cover here. We cover primarily kids, pregnant women, people with disabilities, and seniors. This apparently is, all those polling, people that are really smart and expert at this have said that these things is what works. And also talking about the SNAP cuts, in addition to Medicaid cuts, works in tandem. Saying the two together and how it increases cost to families works. Okay, avoid getting too much in the weeds like I did. You don't have to go into the weeds like I did, but I just want you all to know it. Okay, what can you do? Here are a few resources. Some of these are hot off the press. So if you just want to know what's in this bill and how it affects Texas, look at the first one. That's a new blog. Our statement from several Texas groups. If you want to know in a particular congressional district how many people are in Medicaid and how many kids, look at this second one. We've got congressional district data there for Texas. If you want to do phone calls, look at the third one. Our Action Center won't let us do emails and phone calls in the same system. So if you want to do phone calls, it's on the Cover Texas Now website. If you want to do emails, oh, I put the wrong link. I will fix that link. It's on our Texans Care website. We had to do one or the other. I think some people have gotten a little bogged down or discouraged when the lines are clogged, the phone lines in DC. So if you want to do an email, you can do that too. And then here's an action alert from Feeding Texas for the SNAP cuts with messages and talking points there. So you can do all three of these today, tomorrow, the next day, every day. I will say a note on these two targets because Rep. Castro mentioned that. And Andrew, correct me if I'm wrong, these are also the targets for SNAP cuts. These two folks, Monica de la Cruz and Tony Gonzalez, have expressed reluctance, and they could be flippable. They have huge districts. Take a look at their districts, from parts of Bayer all the way to right outside El Paso, along the border, and then down into the valley. If you have congregation members, friends, co-workers, anyone in those areas, they should be making those calls. Those two folks have to hear from us. We don't need to call Rep. Doggett anymore. It's fine, but these are more important. And I'll hand it back to you.
Yeah. And so first of all, if people have questions, feel free to raise your hand or put it in the chat or put it in the Q&A. Any of those things, and someone doubtless will be able to handle it better than I can. I feel like I'm becoming legendary at how bad I am at managing Zoom. So I don't know, but here's what else I want. Just something I am good at is I want to remind you all, and my United Women in Faith on this call in particular, I want to remind you, we are not strangers to this kind of approach to hurting vulnerable people. You all remember when in 2003, the legislature cut CHIP and Medicaid, and it took us years to get those cuts back. And they would say, well, we didn't really cut. It was just that it was all kind of paperwork and administrative changes. And what we know is that that is a really effective way to cut people out of programs. It's not telling them that where to go, how to do the program, how to get their kid enrolled, what papers they're going to need. We would hear people talk about, how many times you have to take the bus to go to a place to get the thing, to turn it into the place that turns out to be the wrong place. This is kind of old style suppression of enrollment. That is one of the things Texas knows well, and our state has already proven itself to be a willing partner with the feds in that kind of behavior. So it's really important for us, and we see in the legislative session unwillingness to fix that where it already exists in our state. So that's thing number one. Thing number two is you all, and this is not just United Women in Faith, all of you, you all have stories not just about when the congressman and when our colleagues around the country, when they talk about they want to hear people's stories, we often think the story must be about me or my family and the particular concerns that we have. But you all are in a position to know the stories of your community. You are at your congregation. You know who's using your child care center at your church, who is on Medicaid or CHIP. You at your food pantry know the people who are running out of their food stamp, their SNAP benefits halfway through the month, right? You know the people who are already have problems that these are going to exacerbate. And you know the people in your congregation who have the parent who is getting home and community-based services through Medicaid, where that adult child won't be able to go to work and feel confident about the services their parent is getting. They won't be able to stay in their own home. This is not, it doesn't have to be that you yourself have the problem. You need to be able to tell the story of your community and how this will hurt. We do have a lot of people, and I want to say a lot of judicatories that intersect. And so we all know in this, Adriana, sorry for the jargon, but we have Methodist Annual Conference, Lutheran Synod, Presbytery, 2 or 3 Catholic dioceses at least, and an archdiocese, all intersecting in San Antonio. So we need to be sure that those denominational bodies are getting the message right now at that level, that your bishop, your presbyter, your interim presbyter, I realize I'm in Mission Presbytery, but we need to make sure that we're getting the message to our own denominational offices and asking them to send the information out broadly. This isn't a few people, a couple of you on this call maybe have been the recipients of calls from me this week, even where I said, I'm calling you because you particularly are the person who needs to make a call to your state legislator about a specific thing. This is not that. This is all comers, everybody. It is really frustrating to Adriana, to me, to all of our colleagues working at the Capitol, that in the middle of everything that's going on in our state, this is getting ready to happen. And I promise your legislature has no plans to fund 15% of SNAP. They just don't. They can't be bothered to, and I'm sorry to use language like that, but they can't be bothered to fund the little bits of things that people are asking for that are already on the table. They don't have a plan for coming back in a special session to allocate an additional $2 billion for SNAP. They're going to say, so sad, too bad. It was good while it lasted. So the place to stop this is in Congress, and the place to stop it in the case of Texas is in the House, not the Senate, because our senators are not going to be receptive. So with that, I will ask if anyone has questions about any of this, or Adriana or Andrew, if you want to add anything. Nobody's got questions. I know it is rough for a Thursday night, but I really appreciate everyone being here. And Texas Impact's newsletter, as you know, will go out tomorrow late in the afternoon. We'll have all of this information in it. We'll have the recording. Rebecca McElwain, you've got a thing to add.
Yeah, if I could just say, if anybody on the call is from San Antonio, on Saturday morning from 9 to 10:30, We are having a meeting at the San Antonio Mennonite Church on St. Mary's. You can Google the address or email me and I'll send it to you, because we are going to see what we can do for Gonzalez and Dela Cruz to really bombard them with stories and phone calls. So please come to that, reach out to me. And also, and I put my email there in the chat, Rebecca@texasimpact.org. I just want to underscore the stories. I've been on a lot of calls about this now lately, and everybody is saying the same thing. Number one, it is working. The calls do work, just what Andrew and said, and the congressman. And number two, stories, stories, stories.
Absolutely.
Yes, and I agree on that. You know, if we had a whole bunch of time, I would say, let's do all these various efforts. You know, th we don't have time for that because it is coming out of committee very soon. I know Andrew mentioned this. It may be on the House floor next week.
Yeah.
So Monica de la Cruz and Gonzalez are going to have to take a vote. They voted on the concept before.
So we have somebody asking, do the links have detail on the impact on the deficit? Oh, my rep will not care about SNAP, but will not be happy about adding to the deficit. We can maybe kind of guess who your rep is there, Emma Mark. Do we have more? Do we have more information? Andrew, can you drill down on the deficit stuff a little bit in handouts, slides, things like that we can share?
Yeah, I can add a link to the report that I sort of referenced. I would just be cautious too about deficit messaging. I'd be curious about your opinion, Bea and Andriana, but obviously, like this fight will become between Republicans who are moderates and the fiscal hawks who want to increase cuts even more and are going to be like reluctant to sort of vote for anything that increases the deficit, right? So I would say that it is worth sort of flagging these deficit concerns, but like if we are going to address the deficit, like Medicaid, SNAP, low-income people should not be paying the brunt of those costs. You know what I mean? So I'd just be careful and nuance that a bit. But I can add the report about the impact to the debt later in the chat.
I think I would have a question for Adriana and Andrew, for both of you, about the messaging around tax cuts for wealthy on the backs of low-income people. For
Right.
a lot of us in the faith communities, that feels like a very natural message point, but I wonder if it's resonating.
Apparently, I was interested in that too, because it's not coming through that these cuts are to balance the ledger with the tax cuts on the other that are going to be all pulled together. Apparently, that did not test well with conservatives. So it's good for liberal audiences. So if you maybe have friends who are liberal but need to understand why this matters to them, you could use it with them. But apparently it didn't test well.
That doesn't surprise. It's more about the conversation of the impact to the debt and sustainability, right? For the Lutherans on this call, by the way, a great sort of jumping off point is our social teaching on economic life called Sufficient and Sustainable Livelihood for All, which really goes into the theology of saying we should be providing a basis for the people in the greatest need, but also they should be a sustainable process, right? So like there is a correct balance here, I think, and a lot of us do have social teachings about this. I can drop that in the chat for the Lutherans in the crowd, if that's helpful.
Well, yeah, and just for everyone, just to be aware that at Texas Impact, we are equal opportunity denominational resource users. So whether you are an ELCA Lutheran or you just can use that same information, and all of our other denominations have this too. GBCS, for the Methodists in the crowd, the General Board of Church and Society, Camille is working on this, just couldn't get away tonight. And for the other folks, again, like I see we've got a couple of Episcopalians, the Episcopal Church also. And Andrew, can you remind us the name of the woman who's your Episcopal colleague? If not, don't worry about it. But
It's a man, Lindsay Delks, and I can give you his email after this call if you want.
Yeah. Ron says, does citing scripture and theology resonate in the messaging to conservatives? Andrew, you want to?
Absolutely. And in fact, I think one of the reasons why the faith community is so important here is that these social programs are losing the moral message. You know what I mean? Like the moral framing is that these are corrupt, full of fraud, whatever. Like we need to sort of really rebrand, like sort of like the good that these programs provide and these how essential they are, right? And no one's better at doing that than the faith community, right? So scripture, theology, diving back to the base moral grounding of where we come from is a huge. This is why like we are more essential to this because people can come to this with as many facts and figures and stats, but if you don't change the moral identity of what we're talking about here, then it's not going to make a dent.
We speak the language, exactly. And not to just like harp mercilessly on the stories, but the story of your congregation sitting in your particular spot, in your particular community, with your particular outreach ministries, that is concrete for your member of Congress. They don't know about you if you haven't told them about you. But if you tell them about you and you say, this is how we know because we see, I see this woman, Mildred, who comes to the food pantry, and here's what I know about her, right? That really is helpful. And I think sometimes we lose it seems so obvious to us. Well, yeah, of course. I mean, we work at, my food pantry at my church is called Uplift. And people think, well, sure, everybody knows about Uplift because we always have a big line of people out the door. Everybody must know about it. Well, I promise your legislator doesn't, and your member of Congress definitely doesn't. So don't overlook the treasure of your own experience and don't take too long to dig it up because we need it right now. What about letters to the editor, y'all? Is that relevant right now?
I think yes. The problem is time
Time. It's get it out fast.
to get that turned around. But there are going to be reporters doing stories and they need quotes. So, they'll do a story. There's some national reporters and then there's some Texas ones. The problem is a lot of them are
Doing
at the Texas Capitol. Yeah. So, but there will be some stories leading up to the vote next week. So they always need help putting a few quotes in there. So I am sure they would love to quote a faith leader or a family member talking about the importance of Medicaid to them. That is one of the hardest things to find. Someone who's, families are busy, willing to talk to a reporter during the day or provide a little quote.
The reality is, y'all, Adriana's colleague, Peter Clark, a good a good old colleague of Texas, in fact, from way back, who used to work for Mike Villarreal, who some of you may remember as one of y'all's former representatives. But Peter is a point of contact for us on media relations. So if you're on this call and you are someone who believes that you have a story or would be interested in providing a quote or anything like that, if you let us know, I will just tell you that what Texas Impact will do is funnel you to Peter. We've already done that with a couple of people who have responded to us, especially somebody from Houston who's on our board. So if that's something you feel called to do, is to speak to media, let us know and we'll get you to Peter and he'll be able to manage it. So, and hang on, I know I had a message here from somebody.
I just put in the chat the 3 action centers, one to call Congress, one to email Congress, and then one that's specific to SNAP.
That is great. And Andrew, I know you had one more thing you were going to say.
Yeah, I think this is kind of really important for Texas, actually, just because in the SNAP hearings and the Medicaid hearing, you hear lawmakers who say, oh, my state has a surplus. We will be able to cover this, right? So what is really important is you should be talking to your state lawmakers too, basically saying you need to be talking to your federal counterparts right now because they do talk to each other. State do talk to their federal counterparts and basically say like, no, this isn't going to happen. You know what I mean? If that communication isn't happening, then your federal lawmakers might say like, okay, our state might be fine, and that needs to be really clearly communicated, right?
And there's even an additional version of that, which is if you are if you're, for example, if you're in San Antonio, but if you're in San Marcos, Seguin, McAllen, don't hesitate to talk to your local elected officials and tell them, you guys better talk to people about this because this is going to have a terrible impact in this particular community. Those local officials, every one of them sees their future as sitting in the Texas Capitol on their way to Congress. And this is the way it works. They will talk to the next person up the food chain and say, if our community gets hit by this, I'm coming for your job. So uh, don't don't leave any stone unturned in that chain of command, you know. Y'all, it is almost 7 o'clock, and we crossed our hearts that we were going to keep this to a very tight hour because everybody is working real hard. I really appreciate everybody sticking with it. And Andrew and Adriana, thank you so much for taking time. It's just crazy, but
Thank you so much, B and Texas Impact and everyone who joined tonight. If we work together, we can fight this.
Thank you. It looks like B froze, so I'll just echo her thanks.
Thanks.
And we appreciate you being here with us. Have a good night, everybody.